I want to talk a lot about numbers because you heard John Scholes in his presentation talk a lot about metrics, both positive and negative, in the city of Seattle. So we're going to share the last part of this presentation today talking seriously about public safety downtown and the fentanyl crisis and the increasing rates that John showed us earlier. And I want to start with you, Chief Diaz, because we are talking about numbers. And I don't think a lot of people heard this number a couple of weeks ago. We heard the mayor say property crime is down in the city of Seattle. You told the Seattle City Council that is not accurate.
Yes, so when you look at property crime, last year it was down about 10%. This year we're already seeing that same reduction. But when you talk to businesses, businesses have expressed, I've been burglarized 15 times. I don't call the police anymore. And so when you actually get to the ground, people are struggling. They're being impacted where their windows are being broken. And a lot of that sometimes is contributed to people in mental health that are experiencing. And so they're covering those costs because they feel like if I don't, I'm not going to end up getting anything from the police department as far as just a police report. And I'm going to end up sometimes having to deal with my insurance, which they're going to raise my rates, or sometimes not even have me be insured. And so these are the challenges that we're dealing with. We know that over time that people don't always report property crime, but I think that right now over the last several years, we've actually seen it where it's becoming a lot more prevalent.
And underreported, and the reason why, and I think there's been a connection between this, is the lack of police officers. I know you're going to give a presentation before the Seattle City Council on Tuesday regarding staffing, but if you want to break any news here in front of this crowd, where do you stand with staffing and hiring, since we know you've been short for a long time?
Yeah, so we've lost 725 officers over the last 5 years. You have to look at the department at that time in 2019 was about 1,425 officers. So you could imagine we've lost half the staff. That means that there's no officers that would be patrolling the streets, and your investigations bureau would be completely decimated as well. We've hired a lot of people. We've still down 375 officers. So there's still a huge impact of what we're experiencing. We're working our officers a lot. Last year's overtime, just for the amount of officers or the amount of time, was equivalent of about 100 officers. And so we're making it up through overtime, but we have to be very, very cautious that we don't burn our people out.
There was debate before the old city council that the bonuses, that money should be used for something else, should be used for drug treatment programs. If those bonuses aren't working, was that old council correct that this has not been a program that's worked?
Well, for me, I believe that we have to have an equal playing field with all other police departments. If other departments are enhancing with incentives and bonuses, we have to be able to do that same stuff for our department. So, that is going to be part of that discussion next Tuesday. But I do think that we have to figure out how we incentivize people to come into this job as well.
I'd like to put some of the data back up on the screen as we talk about the trend lines downtown and the overdose calls. As I talked to you, City Attorney Davison, you were a big proponent of the Blake fix and fixing the drug ordinance here in the city of Seattle, but we have seen the overdose numbers as they continue to go up. How many people have actually been charged or treated as a result of that drug ordinance?
It has only been in effect since October, so we have a few months. I'll check with our chief too. I have about 220 people that have been arrested on that. And I think the piece that I'm really wanting to focus on is that enforcement is really part of what we're talking about. Enforcement really is what we need. When we're talking about what John presented and how we want to have more predictability about the safety of sidewalks and public transit, it's because we need to say that our laws have mattered, and we do have a drug law now, which we did not have, and so now we need to enforce on that, because otherwise, I do think it's not compassionate to hold people accountable. That's when we're hopeful for the people's best self, is showing we care.
There's been some scuttlebutt, City Attorney Davison, about an ordinance on how many times somebody can overdose and refuse treatment. We heard the city council president in front of everybody here tease something is coming. Care to elaborate?
Well, that's her thing to say. I'll say for Council President Nelson. But I really do think that it's not, we shouldn't think that that's something we should shy away from. We should not be reticent to enforce our laws and to put that in there, because that's really where we're saying, again, with our systems, we care enough to actually act. When we don't care, we don't act. And we saw with the numbers, it's do or die. We really do need to do something, because the cost is great to people who are overdosing and is great for our economic impact and positive growth in downtown.
One of the issues that this crowd has been concerned about is graffiti. You have the ability now to do something about that, but there's still a lot of graffiti in this city. How are you going to crack down?
There is a lot. We did not have a lot of enforcement prior to my arrival. We did have an injunction. I'm really proud of my staff, our line attorneys, who got that injunction overturned at the Ninth Circuit. So we do have that available, and that is something that we are actively working on. And so we do know there are crews that are out there doing this, individuals who think it's okay to do, but it is destruction. It does cost a lot, and it does create a lot of visual blight, which in my mind invites a lot more criminal activity.
So a lot of people in this room have seen the two of you, but they have not seen Amy, who is the head of the Community Assisted Response and Engagement Program.
You got it.
CARE. It is a new program. You are the third arm of law enforcement. Have you seen any early improvements downtown from where you sit?
Third arm of public safety, not
That's
of law
another way to say
enforcement. Yeah, no, it's different, yeah. So community safety, I think we're seeing improvements because we're starting to alleviate the burden on other first responders. So I talk to Chief Diaz all the time, I talk to Chief Scoggins all the time, Health 99, and we've got to create capacity in the system. They can't staff up fast enough, and we can't scale fentanyl response fast enough, so it's nice to have a new kind of professional go out to 911 calls.
I heard John Scholes here last year say that the city of Seattle should treat the fentanyl crisis like the COVID response.
Yes.
Oregon and Portland in particular have a state of emergency in effect that was issued by the governor there because of the fentanyl crisis, that you can make the argument, I've been down there, I've seen it firsthand, it's 10 times worse than what we have seen in Seattle and King County. Why isn't the city of Seattle and King County treating the fentanyl crisis like COVID?
I don't know that we're not about to. I mean, I agree with everything I've heard today, that there is strong consensus, there is awareness that this is an emergency, that people are dying at unprecedented rates. It's unacceptable. I wake up every morning and look at that overdose dashboard. I look at the age of folks who are dying, and the medical community is telling us that people might live with this addiction for 2 years. And so I often, I run 911, and I often make I draw the corollary that when somebody calls 911 threatening to jump, I go out and get them. I send lights and sirens, and we get them to give them a chance at life, and we're not doing the same thing right now with fentanyl.
City Attorney Davison, do you agree? Do you agree with what she just said? Do you think that the city should take a different approach here with the fentanyl crisis?
I think it's a substance we've never seen before, and I don't think that we should think that it's individuals are capable of choosing to go away from it. It is so addictive, it is so potent, and it is so deadly. And it is deadly to our young children who are being exposed just because they happen to be in an area around somebody who's using the substance.
Is there anybody on this panel who has talked to your colleagues in Portland about best practices and what they are seeing in the first couple of months of this emergency, Amy?
Yeah, I just did. So Mike Myers is my counterpart, and I know that we talked to the police chief down there, and really what they're doing is treating it like COVID. They have a joint command call every morning at about 8. They're very, very focused on law enforcement partnerships that are targeting the dealers. So they are criminalizing the dealers. That's the focus. And so they go into the hotspots, make an arrest. My understanding is this is with partnership at the federal level. And then the term they use with me is saturate. They saturate the area. The folks who have been victimized by these dealers are brought inside or offered emergency temporary shelter, and they're being incented to accept the shelter. They're being offered actual support, medical support if they need it, so that they can create a pathway into permanent supportive housing.
Chief?
So yes, we're actually having communication with San Francisco as well. As you imagine, because of the Blake decision, it really created a huge infusion of fentanyl into our community. 5 years ago, 5, 6 years ago, we were about 500 pills. We recovered 2 million pills last year. with our federal partners. And what pill was about 15 bucks a pill, we're under $1 a pill. And so you think that when you actually talk to people on the street and they're using anywhere from 15 to 20 doses a day, that seems like a habit of about $15 to $20, but they've got to steal for that habit as well. And in order for them to do that, you're stealing $50 to $60, if not $100 for that. So this crisis not only has the overdose impact, but it also has an impact to a lot of our small businesses, a lot of our just overall business environment that affects the downtown core. Because we know that 3rd and Pine and 3rd and Pike and 12th and Jackson have been areas for trafficking of property. And not only are we dealing with fentanyl, that actually every single time, and it seems like every single time that we're arresting somebody for dealing fentanyl, we're recovering a gun as well. When I was actually working with the anti-crime team way back in the day, we would find sometimes dealers selling crack cocaine or heroin, but we weren't recovering a gun every time that situation happened. With fentanyl, we are recovering a lot more firearms. So it's more dangerous, not only for the user, but the actual environment is actually a lot more dangerous as well.
So I just asked the city attorney about the ordinance. You just mentioned particular spots around town. 12th and Jackson is still bad, and those areas on 3rd and 4th are still bad. You're the one who's enforcing the drug ordinance. Do you think it's made any difference?
Yeah, well, I actually would say 12th and Jackson has gotten a lot better. And I was just on an email string with our community who actually also noted that they feel it's improving. They still have a long road ahead, but 3rd and Pine and 3rd and Pike is still a huge challenge. We've actually staffed officers in both areas. I actually have it between 12th and Jackson is really roughly about 8 in the morning to about 8 in the evening, because we have a school that's very short or very close by. At 3rd and Pine and 3rd and Pike, we have another set of officers that come in for about 7 more hours to provide emphasis patrols there. So we're trying to make sure that we're having an impact with that. We're running operations where we actually are targeting not only users but also dealers. And so we do find ourselves, like sometimes you find a little bit of a whack-a-mole, because you go into an area, they make some arrests, they go back to the precincts, and a lot of times that whole group is, another group is back occupying that space. So that's a huge challenge for us as well.
I think it's the first time anybody's talked to you since we heard what the state legislature did earlier in this week on the police pursuit laws. So as we talk about enforcement on these laws, when that police pursuit law goes into effect in 90 days after the session, is that going to change anything for the Seattle Police Department?
We are actually evaluating right now currently our vehicle pursuit policy, as well as our vehicle tactics policies, such as pinning vehicles, especially when people are sometimes passed out, because we are experiencing people that are going through fentanyl overdoses, but they're passed out at the wheel. And so we also have to make a safe environment to make sure they're not driving off. So we're currently doing that right now. We're actually in the midst of training our vehicle tactics policy. But right now, we also I'm mindful of when you loosen up some of the standards, our biggest payouts for sometimes traffic deaths because of a pursuit death are in this area. And so we really have to we tend to be a lot more restrictive when it comes to our vehicle pursuit policy. I had 9,000 stolen vehicles last year in this city. So we want to make sure that we push it to the edge of where we think is still keeping people safe in the community, but also making sure that we're not making a harm to the community by pursuing everything that's out there.
So now that we've painted a really dark picture, let's talk about something positive. Amy, you are relatively new to this gig.
Yep.
You've been making the rounds.
Yep.
You have seen what has happened over the course of the last few months. Is there reason for optimism for this crowd?
Yeah, I always say I'm the most optimistic because I just got here. I've never been around politics before. I think everyone gets along. I think labor's fun to work with, and city and the county and everything goes well. And honestly, that has been my experience. I've just wrapped up my first year. I'm career nonprofit. I'm used to being on the front lines of service provision, and so that's where I still spend a lot of my day, trying to identify what the gaps in the system are, especially across the medical community, clinical, social work, outreach. And it's really encouraging how much consistency there is. And I think that's what we need here is some intellectual and ethical consistency in our policy design. The mayor's office has been great to work with. I think people are curious. I'm known for being very candid, and people are curious if I get notes on that. I don't. I've been very supported to answer questions as I see them, as the literature reflects. And I'm having a great experience with this council as well. So I think we're going to see a lot of change and a lot of collaboration and a lot of improvement as we stay anchored in the evidence.
Chief, with those shortages you're talking about, how can people be optimistic about the future of Seattle?
I'm very optimistic in the sense of, our officers are doing a phenomenal work. Just this last weekend, we actually made we made 3 homicide arrests, and obviously you don't want any homicides, but to make 3 homicide arrests in a weekend. That's just the amount of effort that is going into these investigations, the amount of time that our officers and detectives are committed to doing the work. Last year, we recovered more guns than we've ever recovered, even with 375 less officers. We made more arrests. All of our crime stats are going down. So even if you look at last year, robbery, aggravated assault, rape, and not homicide. Homicide was the only one that was really up, as well as motor vehicle theft. But you're seeing crime stats start to actually tread in the right direction. And we're looking at these trends to make sure that, are they just kind of like a seasonal trend? And they're not, they're holding. And so I think that's a really amazing work to our command staff that's also trying to make sure we put the officers in the right spot, to the officers that are going out and doing the work every single day. So I think, honestly, and the mayor's office has been extremely supportive. Addressing a lot of, having CARE really help us out with crisis calls, massively improvement. When you look at homeless issues, having, the UCT team, all these are supportive of us. So we need these resources to be able to do the job.
City Attorney Davison, we talked a lot about drug addiction, crime. Any reason to be optimistic?
Absolutely. I'm very thankful to have a lot of new people to government, especially on the council. I think new people to government is really a fantastic view that we can all gain from. New eyes on the same problem of also expecting it in a different delivery of time. It doesn't have to take years upon years to actually see some of the change. I think to be able to let loose and to say, we can come together, we actually have people who now want to problem solve, not be divisive in rhetoric, but actually look at what is the best approach. Do we call everything under one label and then we just get it all bogged down and we don't actually be really distinct in identifying the problem so that then we can find a solution? Now we are starting to identify problems correctly. We have people who want to work together and problem solve, and I think that is absolutely a place to have hope.
So in my business, people are told to know their crowd and know their audience. So we'll end with this. You've got a lot of people in the business community here, a lot of people in construction, a lot of people who would like to see the city change course. I have been down to Los Angeles and I've seen how the private business community created a fund to attract police officers for housing. I have heard you, Chief, talk about zoning changes and how important that is to get foot traffic to increase public safety. And there's going to be a big rezone conversation in this town over the next several months. So I think let's start with Amy. Is there anything in the private community that can be done to reduce the addiction and reduce the criminal problems that we're seeing in the city of Seattle right now?
Yeah, I think the first thing is just to acknowledge the officers. We talk a lot about how to incent officers to be here, but I sit in 911 and I know this is a hard place to be a cop. We need to demonstrate our support of these officers. I observe all the time their expertise in human behavior, their kindness, their compassion. They're working overtime all the time, and it just doesn't really get acknowledged, so I think we can do that. I think my request of this group would be to not politicize these conversations. It's not useful. These are not political questions. We have people who are suffering. We have medical emergency, clinical emergency, and this is not about politics. And so I think we'll be able to get much further down the path of response if we don't debate it so much. I didn't like in the fall when people debated my title for a month. I have no interest in that. People are suffering.
Chief, quickly.
I couldn't agree more with making sure that we recognize the officers. We're working towards getting a contract, and our officers are, charging hard. We're getting, some of the capacity built up for other units. But what's also is that we're really streaming ahead for World Cup 2026, and I think that's really going to showcase this city, and I think we're going to be ready for it. I know, actually, I'm not going to think I know we'll be ready for it.
City Attorney, you get the last word. Anything that the private business community can do to make things better?
I still want you to focus on, we need to have in-custody treatment. If we are going to be making a difference, it has to encompass all aspects of how we deal with this battle. It can't just be one of the tools that we have. It has to be all of them, and that means we have to focus on in-custody treatment, and we have to build out re-entry for somebody at the other side of that. And that includes at the misdemeanor level, because that is really where we are closest to root cause. We need to address it then so we don't invite and have increase in criminal activity in the felony level. We need to do it right the first time. We need to focus at the misdemeanor level, build out that system, the entire process, not just at the front, but throughout the entire system. And it will require all of you to be a part of that, because many of you provide those services, and many of you will employ those people because they can make a recovery, they can come back to society, and it starts by showing that we care, by enforcing our laws, and we bring people in through and get them back at the end.
Thank you. Seattle City Attorney Ann Davison, Police Chief Adrian Diaz, Amy Smith, AIR, the not law enforcement, public safety arm, the third public safety arm.
Correct.
3 department heads and then some guy sitting on a stage. Thank you. And
With a nice tie.
thank you. I try. And now to close us out, Sun Yang.